Yes.
Can you be specific about the type of medication?
There's a variety, there's scheduled substances like narcotic type medications.
So is the DEA involved then? Do they monitor controlled substances?
So again, we don't have any evidence that there was, we don't have conclusive evidence of diversion at this moment going on. So the DEA may be aware of it, but they're not involved at this particular point.
Would you, was there a blood test then that would relate back to the 2012 incident after you later found out that this employee cared for that person?
So I don't want to give you any information on the former employee's health status, because that's still private information. The patient back in August of 2012 had hepatitis C, discovered in late 2012.
So how would you be able to, with a blood test, be able to tell between the caregiver and the patient if there was a?
If the caregiver, well, I don't want to give information about what the caregiver's health status is, because they still have a right to privacy. But in general, when you have two people with hepatitis C infections, you can use genetic testing to see whether they match with each other or not.
I know you can't say it, but it seems pretty, we would have to assume that if you're concerned about hepatitis C for these 936 people, that the caregiver must have hepatitis C, and that's what you're concerned about, that person passing.
So there's lots of different ways to, if you're diverting to spreading hepatitis C, you can spread it from another patient and take some drug and then give it to another patient as well. So, I can't go into all the different ways you can spread hepatitis C, but in respect for the privacy of this person, has not been found to have, no evidence that they've actually transmitted infection. I don't want to reveal what their health status is.
But in general, the most likely way to spread it would be from someone who has hepatitis C.
Well, you could, I'll give you another scenario since you're asking. You can give a small dose of medication to one patient, take some for yourself, and then give some more to another patient. There's a lot, so you could give a drug to a patient with hepatitis C, then inject yourself, and then use the same syringe for somebody else. There's many different ways that this can occur. It's blood contact.
I think if part of your question is does lab testing technology exist to potentially test it?
But did you say that was inconclusive, that you did a test like that was inconclusive, or did I mishear?
I said inconclusive.
There was a test done trying to match the
Which was
caregiver and the
inconclusive.
2012 patient, and it was inconclusive.
Correct.
So is there a chance that the result of this investigation is just inconclusive? Because it sounds like there's a lot of suspicion and a lot of, I don't know how many hospital employees came forward with their suspicions, but a lot of suspicion that this has happened, but nothing to back it up.
Yeah, that's a really good question. I don't know whether folks heard that or
Let me
not.
repeat the question. The question is it possible that after all this investigation, the results may be inconclusive?
So, when we do an investigation, we don't go in with a priori knowledge of the results. That's why we're doing an investigation. I wish that every epidemiologic investigation I did, I was able to get, nice tidy results that actually prove something. And again, remember, the risk is really low here. I'm not expecting to find a large number of people who have infection here. So there's a very good chance that we may not find anything here in terms of the risk from exposure from this caregiver. And actually, for the people involved and the patients involved, I'm really hoping that we find nothing. None of us want people to get infected with hepatitis C. That being said, if we can't find an association between this caregiver and the patients this caregiver provided care for, we may want to look again to see if there's any other possible kind of cross-contamination that might have occurred. We think the risk of that is really pretty small, but we may go back and look at that again. But cross-contamination, some sort of sterile technique breakdown, which we have no evidence for. But we might go back and do a second round of testing if this first round is inconclusive.
What does it take to the suspicion level to rise to the level that you do start investigating? If you don't have evidence and it's just suspicion, are we talking about number of hospital employees that came forward with concerns? What is that threshold?
Yeah, well,
Let me repeat that again.
Okay, I'm sorry.
The question is, what does it take? What does it take in order to raise the suspicion level high enough so that we would conduct an investigation of this sort
Without evidence?
without the hard evidence?
So we have a patient that we talked about in August of 2012. I'm sorry, late 2012, who had acute hepatitis C, whose only risk of exposure that we could identify through interviews. Now, we're not always, people don't always tell us everything through interviews, but we can only identify their hospitalization at PeaceHealth as a risk factor for that. They received intravenous, for example, medications there. We also have enough of a suspicion of drug diversion going on that has raised a level of concern that we need to be doing this. So that's basically you're asking me for the criteria that we use. Yeah.
Can you quantify the amount of drugs that think were diverted? I mean, is it?
We don't have, all we know is that we're talking about 2 years worth of care here, that this person, this former employee who are concerned about diversion had provided care for, going back to early to mid 2012. So the potential is for large quantities there, but again, we don't have evidence that that indeed happened. Criteria, you're asking about criteria. We have a very low, given our concern about hepatitis C and given PeaceHealth's concern about protecting their patients, we're using the lowest level of criteria we possibly can to do this. This may be overkill in terms of doing this. I think the risk is low, but we don't want to take any chance on this. Hepatitis C is a concern enough that we're really using fairly low criteria to go ahead and do this.
As we said last couple weeks ago, we are exercising a great deal of caution. And I think that's because our organizations are here committed to the health of our patients in our community, and we think that's the appropriate threshold.
How long were they with PeaceHealth? How many years?
Approximately 2 years.
So it kind of makes sense here, hearing the timeline, everything explained, but can you kind of sum it up, Mr. Johnson, why all the way back to August 2012, and now this is just coming out with 936 patients potentially infected with hepatitis C in a year and a half later?
The evidence of potential drug diversion did not occur until February 2014. It was the investigation of that and the awareness that former employee provided care to the patient in 2012. That's why we're talking about this now. Until that point in time, we did not have evidence to pursue.
So we just found out about it recently, but the other point I want to make, and we're not the first locality to have this problem. There have been issues with hepatitis C involving hospitals elsewhere in the United States. And as I mentioned, we're really working closely with the CDC on this. Once somebody is a diverter, it usually isn't something that happens overnight, that they suddenly become a diverter. So given that we didn't find out about it until February, March of 2014, but the bottom line with what's known about people who divert drugs, healthcare workers who divert drugs, is they don't suddenly become diverters overnight. That's why they've often had a history of diversion. It's the nature of people who have chronic chemical dependency issues. That's why we're going back to the when they first started working there. If that's your question.
Are any hospital policies being reviewed in case this did happen to make sure it doesn't happen?
The answer is yes. We have strong policies and procedures in place to protect patients and have had for some time. However, as we have been working through this investigation, we are reviewing those and making adjustments, and any opportunity we have to enhance those, we're taking.
And why are you not telling us what the employee's position was or what department they worked in?
Because of privacy concerns about that former employee and the fact that, as Dr. Melnick has articulated a few times, we don't have evidence of that would allow us to go further.
How would that hurt, though, saying what department they worked in?
Once you get down to small numbers, when you narrow it down to department, it becomes identifiable. And we're interested in protecting privacy. And we feel the people who need to know, the 936 people who might have been exposed, are getting the information. So we feel confident about that. And there's really no need at this point to identify this former employee.
The 936, are they adults, children? What's the age range?
They're patients of PeaceHealth Southwest, primarily adults. if there are children, there would be very few. It's primarily adults.
If we told you more, we'd give more information about the exact location, and we're really trying to protect privacy at this point in the investigation.
Who alerted you to the suspicion of drug diversion earlier this year?
We have policies about reasonable suspicion, so if any employee is acting in a way that causes any questions or concerns, that gets escalated. It was courageous employees who identified unusual behavior in that escalation that
More than employees, several.
it was those that were working with this former employee at that time.
Can you say how many?
It was a few.
Over the course of a period of time or all?
It was a single.
Single, okay. In February of 2014?
Correct.
Do you have an expected timeline as to when the first, if there's more than one round of testing would be completed by?
So there's a lot of steps that need to be taken now. As you can imagine, the notifications go out, and then people have to go in, and this is voluntary. People voluntarily get tested. So there's going to be some lag time, depending on how soon people get in. And especially we're offering people to go to their own providers, as well as Quest testing centers. Then the results have to, the labs, it could be several days for the results. And then if people do have an infection with Hep C and have virus in their blood, the sample is going to be sent to CDC for genetic sequencing. So the bottom line, it may be several weeks before we get back to you on this particular situation. So we'll have, we'll let you know, and we'll have more information then. And we're going to try to make sure that everybody gets notified. If people don't come in, we may do some follow-up to encourage people to come in.
If your results come back inconclusive, what happens to this employee? Could he or she return to the hospital, or is there enough evidence of misuse of drugs that there will be some sort of disciplinary action, criminal charge?
Let me repeat the question. The question is, if the investigation winds up inconclusive, is it possible that the former employee could come back to work at PeaceHealth Southwest?
I think regarding actions with the employee, they'll be based on the facts. So the facts available is what will determine what the follow-up steps are. If there are no facts to do further follow-up on, there wouldn't be further follow-up done. As I've already said, we will continue to follow appropriate policies and working with Clark County Public Health and make sure that any other agencies or organizations who should be aware are made aware, all based on the facts.
So just to add on to that, we're working closely with the State Department of Health. Among other things, the State Department of Health does professional licensing as well. So, and I can't give you, again, I don't want to reveal what this employee's license level is, but I can tell you that the licensing agencies involved are involved. I mean, the appropriate licensing agencies at the state level are involved.
And to clarify, this is a former employee, not a suspended employee. They're no longer an employee here?
Correct.
At what point were they dismissed, fired, let go?
There were not additional shifts worked after the suspicious event.
February of
Correct.
2014. Can you give any idea to the volume of drugs that this employee may have used? Frequency?
I don't think we have information to that effect. I think Dr. Melnick commented before.
Yeah, again, we don't have evidence of we have suspicion of diversion. We don't have any information. We don't have any specific information on their drug use or lack thereof.
Maybe this takes guessing, but if some employees pointed this out in February 2014 and hadn't for the 2 years prior, does that give some credence to the idea that maybe this person wasn't a long-term, or maybe it just gotten to the point where they were doing this and diverting drugs?
So again, from studies that have been done, similar situations, people are found to be diverting, and it generally, once you get to the point where you may be having problems enough that you're not as careful as you were before, and you think about chemical dependency, for example, and I've worked a lot in that area, you have people who are doing fairly well. They may be diverting, using drugs or whatever, and then things get out of control and they're discovered. So the bottom line is, with the studies that have been done on diversion, you can't assume that they just suddenly started diverting. Again, we're using due diligence and abundance of caution. We want to make sure that there's no chance, we want to make sure that all these 936 people are notified. I'm not assuming that this suddenly started happening, and that's not what the literature and the experience in terms of other situations has shown.
Did the employees who came forward indicate they had seen previous behaviors they were suspicious of, didn't have any real reason to report until they?
We spoke with employees, obviously, in that investigation and addressed any concerns and questions that they had. Their suspicion was raised in that day, and that was the focus of the investigation.
Is this former employee cooperating?
You want to speak to that?
They've cooperated with our part of the investigation.
From an employment perspective, as a former employee, there isn't an obligation to cooperate.
But from the public health investigation, yes, they have cooperated.